Hi, I'm Emma, and welcome to healthing.ca. This September, more than 120 landmarks across Canada are being lit up blue in support of prostate cancer awareness. The Prostate Cancer Foundation Canada says that they hope this will help spark a national conversation about why so many men are putting off getting tested. Here to speak to us today is legendary broadcast journalist and host of The Bridge, Peter Mansbridge. Peter, thank you so much for taking the time out of your day to speak to us. We really appreciate it. We're talking about prostate cancer in Canada, and I was wondering if we could start off the conversation by just having a bit of a background on what are the statistics of prostate cancer in Canada.
Well, Emma, it's great to talk to you as well. The basic facts around prostate cancer are, that have been explored through this Angus Reid poll are pretty clear. 1 out of 8 Canadian men is likely to get prostate cancer during their life. Now, I know that for a lot of men, they say, well, 7 out of 8, I'm going to be one of those 7 out of 8 because nobody ever thinks, difficult things are going to happen to them. But 1 out of 8 is still a lot. And so the clear message is, stay on top of it, get tested. So that's what I'll be drumming through in this discussion with you, is about that, is about getting tested. Each year, 23,000 men. That's the estimated figure based on the data that has come through. 23,000 Canadian men are going to be diagnosed with prostate cancer. 1 out of 29 is not going to make it through that diagnosis, possibly because they've left it too late. But there's no reason. Prostate cancer is a treatable cancer. And so if you catch it early, and you catch it early by doing regular testing, you can deal with it. So you don't want to be, one of those 29 men who's diagnosed and is not going to make it.
Absolutely. And as well as part of this poll, they found that 63% of Canadians believe that the men in their life are aware of the benefits of getting tested for prostate cancer. However, 61% have also said their loved ones procrastinate getting tested. So, everyone knows you should get tested, and yet so many men aren't getting tested, even though, as you said, it's a very preventable cancer if caught in early stages. What can you say to anyone who's a little bit concerned about getting tested?
Well, you read those stats to them, and that should convince them that it's a good thing to do. It's not, that difficult to be tested. Your doctor, you should consult with your physician or whoever is your medical provider, first of all, about whether they see this the same way. But getting tested once a year, or once every couple of years even, is a good thing to be doing. I was, I'm 75. I was first suggested to me by my physician when I was 45 that I should be tested. And so I've been tested ever since I was 45. It's a good and appropriate thing to do. As I mentioned earlier, one of the things that has people a little bit, feeling where they don't need the testing is that 1 in 8 figure. They go, well, 1 in 8. The odds are it's not going to happen to me, so I don't need to get tested. I remember my dad was like that. He felt that way. Now, as it turned out, he never had prostate cancer. He lived, to a ripe old age. But he was one of those who felt, it's not going to happen to me. Well, you know what? For what you go through for a test, which is pretty straightforward, it's well worth it, and you should be doing it.
And it's a conversation with your doctor, right? Like, it's not this great big massive undertaking. It's something that can be done. So it is important to work into your yearly schedule, as you said. And I've also noticed that there is, in talking with patients through, this work that I do and things like that, there's also a lot of anxiety, I feel like, too, sometimes around getting tested, right? Because there's always that what if, and it's so much easier to be like, no, I'm fine, I'm healthy. I don't have to worry about that. And that's how we kind of deal with that anxiety. Is there any advice you can give to someone who is experiencing that, or if, a spouse or a loved one is noticing that the men in their life are talking like that?
Well, we all get anxious around certain things, and anxiety is a stress factor to some degree. And when it deals with medical issues, you figure, man, I don't want to know Well, actually, you do want to know, right? And you'll feel so much better by knowing. The likelihood is you're going to be fine, and just think how good you're going to feel when you get that result. Now, if you get the other result after regular testing, you're going to know this is highly treatable. And I got it early, and we'll deal with it and move on. So that's, I guess the best way. But I do understand. Listen, people get anxious about jumping off a diving board. So I understand how some people may feel towards this. But the fact of the matter is, the best way you're going to know and move forward with some confidence in your life is to be tested.
And the earlier the better, right? Because the sooner you can get the facts, get the knowledge, then if you have to deal with something, you have the time to deal with it.
That's right. And it's the recommended age is 45. Sometimes some will say 40. But as I said, I'm not a doctor. You have a doctor, so go to it. Go to that doctor. Canadian men like to think that they're invincible. Well, none of us are. So let's just do it, get together, and agree that this is something worth doing. It's like, going to the dentist. Just get it done. Stay ahead of it.
And Peter, you have so many demands on your time. There are so many people and so many charities, I'm sure, who would love to chat with you and work with you. What is it about prostate cancer that drew you to work with them?
Well, I think, you kind of hit on it throughout this interview. It is one of those things where men are kind of resistant to the idea of getting tested. Not all men. I mean, many men get tested regularly, and good for them. But a lot of others don't. A lot of my friends don't. And so I try to impress upon them the reasons why. And when I was approached by a friend of mine who works with the foundation here, I said, yeah, absolutely. It doesn't take that much of my time, and I get to sit on your program. So why wouldn't I do it, right?
And, it's really interesting what you said, that feeling of invincibility and that, nothing's going to strike us down. And I also feel like, obviously, I'm not a man, so I don't want to assume, but there also seems to be a degree of stoicism, and as if you have to project this strength, and dealing with a health issue would be against what a lot of men in our lives are socialized, that they have to be this strong, independent person.
Well, you're right. It is one of these things where you feel it can't happen to you, but the fact is those numbers suggest that it can. It's not that, those aren't the greatest odds in the world, 1 in 8. So why take a chance? I'll just tell you one quick anecdote of, somebody who I covered. Obviously I was a journalist for a long time, but I covered Jack Layton, and when Layton had his bout with prostate cancer, and he beat it in the original go round on it, and I can remember in the 2011 election campaign, we spent some time together. I was doing kind of like a little mini documentary on him. And I can remember one day we were in Prince Edward Island in the back of an SUV of some kind. We were doing some shooting and interviews in different places and watching him campaign. And we were traveling from one location to another in PEI. And it was a beautiful day. I can't remember. I think it was the fall. But it was beautiful weather, and we were going across country roads, and we got to talking about what that experience had been like for him. And one of the things he pressed on was had regular testing. I wish I'd done regular testing, but he had a busy schedule. He had this, he had that throughout his career as a politician, both municipal and federal. And he just made the point, he said, get tested. And so when they came to me and said, would you help us on this campaign? I immediately thought back to Jack Layton, get tested. And so here we are. I'm saying the same thing.
Well, Peter, this has been an incredible opportunity to chat with you. Thank you so much for taking time every day to speak to us about this important topic. We really appreciate it.
Thank you, Emma, and I'm glad to have the opportunity to do it.